How did alternative medicine become a word we use to describe medicine from the earth that has been around for centuries? And at what point did conventional medicine become what was manufactured in labs? And has adopting this mindset around medicine harmed us or helped us? Herbal medicine, traditional Chinese medicine, chiropractic care, naturopathy, why are these considered strange or unacceptable or even dangerous? And yet we've become accustomed to accepting pills and more pills to counteract the side effects of those pills. And at what point do we say enough? Welcome, everybody, to our episode number 18, exploring the world of medicine, finding balance between conventional and alternative approaches. I have my lovely husband with me today, Dr. Jon Peterson.
Hi, how are you?
And I'm so excited about this podcast episode today because it's something we have been exploring and discovering together. Jon is super passionate about the subject.
Absolutely, yeah. The more days go by, I become more and more anti-pharma.
Yeah. So as we know, you're a doctor, which is kind of...
That's a problem.
Well, I don't think it's a problem, but maybe it's what we're talking about today is like that. Where's that line between conventional medicine, what you were trained in, and then alternative, what we call alternative medicine, although it's traditional medicine, if you think about the history of the earth.
It's rather interesting that we're talking about this because we had this exact conversation with some of our friend physicians when we were out of town in Cabo. And I mentioned to them that I'm becoming more and more anti-pharma. And their question was, well, really, how do you advise your patients then?
Right.
So, and that is certainly something to think about.
Absolutely. So we're going to be getting into that today. Jon, tell us, how did the phrase, first of all, alternative medicine come about?
Well, alternative medicine emerged from centuries of traditional practices, rooted in nature and cultural wisdom.
Right.
Modern medicine is, we can say it's more evolved.
Okay.
Right. Some of these practices got labeled alternative, like these old school practices, but they've been around for longer than labs. They've been around longer than pills.
Right. So that it's so curious to me why we call that alternative medicine when really it's been around longer than anything else on the market. I mean, and in cultures that we recognize to be pretty healthy and prosperous cultures.
Absolutely. That shift gained momentum during the rise of pharmaceuticals and advanced medical technologies. Laboratories started producing standardized medications, shaping what we know as conventional medicine. So it's important to remember that even today, many of our conventional treatments still originate in nature. Even pills manufactured in labs are patented from plant-based sources.
So why not just have the plant source? Why have like this manufactured process? Doesn't it take like the health benefits out of the pill? Or?
Yeah, I would say so. I would definitely say so. It's interesting because you go back to alternative medicine, all right?
Right.
Ancient medicine, let's say it that way. Ancient medicine focused very heavily on not just body, but also mind and spirit.
Treating the whole body as a whole and all your aspects as a whole, like you're saying, spiritual and physical, mental, treating all of that with these remedies.
Absolutely. Yeah. It seems like we've kind of gotten away from that. We treat differently nowadays. When I go into the physician, I go in with a complaint.
Right.
And what do? They
solve that complaint usually, right?
They solve that complaint. But, and the hope is that, sure. What if it's an ingrown toenail? That can be a pretty easy fix. But, when we're dealing with chronic disease, it's a completely different problem.
Right.
It's not necessarily the issue that you're having that may be causing the problem. There may be underlying issues. Look at all the problems that a stressed out mind can cause the body.
Yeah.
Well, how do you get to the root of that?
Well, that's like all the mental work, right? Yeah, I know when I've gone to the chiropractor, Dr. Adair, who is amazing. He does amazing work.
Well, if you're in the Valley, absolutely. We recommend
advanced motion chiropractic. But he, he'll relieve the achiness in my body but also, I mean, he treats the whole body as a whole. Like, he talks to me about, like, this is where you're storing your stress. Because I'll be like, why is this hurting? Like, I didn't even do anything to make that hurt. And he'll explain, this is your stress manifesting itself in a physical way. And he does a lot of manipulations that aren't just like the cracking that people think with the chiropractor. They're so afraid of going to the chiropractor, but really they're one of the best doctors to see for holistic approaches to wellness. At least Dr. Adar, anyway, like, he has a whole line of all sorts of herbal supplements and
homeopathics
and oils and things like that he uses for, and he's treating like the whole body, not just, if your back is out of alignment, it might be because something else is going on in your body, your knee or your shoulder or something like that. So I really appreciate finding someone like that. And I think you shop around for the healthcare professional that works for you, right? Because they're not all trained in the same way. And I think with you, you were trained at Temple University, 7 years, you did your time, go Owls. But after that, the learning didn't stop. In fact, I've seen your growth over the last 3 or 4 or 5 years just exponentially increase with the knowledge you have of the human body, the human mind and spirit, and, like we're talking about today, alternative medicine.
Yeah, and part of that learning has taken me into my own problems that I've had myself.
Yeah.
And to be able to learn how to deal with those.
Tell us about those and how, like, alternative medicine has helped in comparison to conventional medicine.
Well, I would say I bought my first private practice in 2012.
Okay.
All right. And
it was a tough year.
Oh my gosh.
We had a baby. We moved into the house, our first big house that we've ever purchased, had the mortgage.
Yeah.
And then you bought your own practice.
Bought my own practice. Within the first month and a half of owning that practice, my fear was, gosh, I'm going to go bankrupt. I don't know. I mean, I would come home just absolutely, completely stressed out.
Yeah.
But, that led to eventually flourishing in the business. But it led to a very unhealthy lifestyle too, did it not?
Working very, very long hours.
Yeah, and where I had some back pains before, I eventually got to the point where I was virtually debilitated. I'd go to work and I'd be able to get everything that I could to work, and I was probably putting in 60 to 80 hours a week, probably closer to 80 hours a week.
Yeah, because it's like not just you were a practicing physician, but then the after hours of marketing,
book work, administration, all of those things. And back pain. I mean, how many times?
Oh my gosh. It was like just our life.
Yeah, it was. I would go to work. I would give everything I could to my patients. And then I would come home and take pain pills and disappear.
Yeah.
And you think about the issue that caused and the issue that it progressed. You might say. We got to the point to where we're shopping for surgeons to do a back fusion on me. When in reality, once it was that last surgeon we met with, he changed my life.
Yeah, he really changed the trajectory of how you approached your health. It woke you up to the reality. And as a spouse, I can only do so much. I think a lot of people can relate to this, as a spouse,
you had all sorts of advice for me.
So much advice that I think would help you and save your life, but you don't want to hear it because I'm your spouse.
No.
And I think that's just a natural tendency we have with the person that we love and trust the most.
Yeah, for sure.
Is to not accept any of their advice. But this doctor was pretty amazing with what he said to you.
He was a younger guy. And, he said, yes, Jon, I'm going to do your back fusions for you. But before I do that, I have 2 words of advice. The first one was lose some weight, which I wasn't quite ready to do that yet. And I was still yo-yoing with my weight because of my unhealthy relationship with food.
Yeah.
And the second was do some yoga. And I'm
like, and you thought that was ridiculous.
Yoga, you idiot. I went away really upset and had a lot to process after that appointment. But I humbled myself out and said, you know what? Okay, what have I got to lose? Let's go ahead and do some yoga.
Right.
So there was a yoga studio down the street, Nam Yoga. They're still here in town in Mesa. I believe they're out on Apache Boulevard now. They've moved since. But I started going to yoga. I was introduced to some very neat people, and I warned the yoga instructors that hey, my back is a real tender spot.
Yeah.
I can't do a lot of things, and they said it's okay, just do what you can. But I would say, yes, the yoga was great for flexibility, but what I was really introduced to is spirituality.
Yeah, which is like a huge benefit of yoga. I mean, yoga is not just a physical practice. It's all about the breath and the energy and connecting your body with your spirit.
Yeah, I would say probably 2 or 3 yoga sessions in. At the end of the session, they have a moment where you can be still and just be in yourself and feel what's going on, and to sit there and break into tears because of what I'm feeling.
Because you're connecting with yourself.
Because I'm connecting.
Right.
But it wasn't very much longer after that. The back pain disappeared.
Yeah. And
the back pain has continued to disappear. I have 0 back pain 8 years later. And it's not that my back got better. I mean, if I went to go to a doctor and he sent me for an MRI, he would see that I'm pretty much bone on bone in my lower back. Absolutely. My back has not gotten better from a cartilage point of view as far as my discs go, but I feel no pain. So why is that?
I don't know.
Well, I would venture to say that my stress and my lack of spiritual connection was causing my back a really significant amount of pain.
So a huge mind, body, spirit connection there.
Absolutely. Yeah, I do. I firmly believe that.
Wow. I didn't realize that you still have that bone on bone in your back, most likely. I mean, we don't know.
No, I mean, I could go get an MRI and check, but I'm certain
I feel
my
fine.
discs are pancakes.
I feel fine. Can I get an MRI just
to
see what's going on? We don't do that really.
No, we don't. But it's neat to not have back pain anymore. But I attribute that to engaging all 3 facets of body, mind, and spirit.
Yeah.
Because now that I am more engaged in my mind and more engaged in my spirit, I have less of a likelihood to want to do things that might injure my back again.
Tell me, so you said that you thought, I mean, when he told you to lose weight and do yoga and you pushed against that, why did you push against it? Do you think it was weird? Did you think it was bad advice? Did you think it wouldn't help? Like, why do we, because this is the topic.
I'm research-based.
Right. The topic today is,
I've got a problem, fix my problem.
Right. And that's the topic today is like conventional medicine, which that's what you were going to find, right? I need back surgery and I'm already on back pain pills.
Yeah.
And alternative medicine or alternative treatments maybe was something that you weren't really prepared to receive at that time.
Absolutely not. No, it's like, it's kind of a mixed bag. Like conventional medicine, it saved countless of lives. All right.
Absolutely. And there's I want to make that clear in this episode. We're not saying like stop taking all your pills at once and only take herbal supplements.
And with me, with dental implants, yes, I can replace teeth. I can make them work great. That's good conventional medicine and surgeries. Vaccines, surgeries, they've saved countless lives.
Right.
However, the focus on the quick fix and like symptom management, sometimes it overlooks these holistic aspects that alternative medicine can offer.
I think that's a good point because as a society, follow me on this, we've become so adapted to quick fixes. And I'm not just talking about like a pill. I think the difference a lot of times with natural remedies versus a pill, pharmaceuticals, is that the pharmaceutical will help immediately. And a lot of times these other supplements take time. Like if you're stress managing, that's going to take a lot of therapy, a lot of sessions with yoga, a lot of visits to the chiropractor or whatever it is, or an herbal supplement might take 3 or 4 or 5 weeks before you start receiving the benefits. But that's just what we're so accustomed to. If we're bored, we open up our phone, we scroll social media.
What if we're in pain?
If we're in pain, we have a quick fix for that. We have quick Advil, we have a painkiller. If we're cold, let's say if we're cold, easy, put on a jacket. If we're hot, turn up the air conditioning. I mean, there's if we're hungry, food is readily available. It's just everywhere. Fast food is everywhere. I mean, I think there's 3 or 4 places just on our on our intersection that we live on. It's just easy, quick. And so I think when we're talking about diet, which we're not really talking about in this episode, how people don't want to go on a quote diet, it's because they enjoy or appreciate the quickness, the ease of processed food, of junk food, of fast food, that sort of thing. And I get it.
Well, it requires change.
It does. And change is so hard. I mean, when we are accustomed to quick fixes, and that feels very comfortable and very natural and very normal, it's very painful to engage your brain in change. Your brain wants to keep you protected and safe and save energy. And so when you are like, okay, you could give up this thing, like let's say a pain pill, but you're going to have pain that will possibly go away over time with this other solution. And even though it might be better for you in the long run, you're going to experience a lot of pain, which is going to cause you to have a lot of emotions around that. It's going to cause you to be maybe angry, maybe be more tired. It's going to cause like all these things. And it's like, okay, do I want to sign up for that? Or do I want to just keep living my life at the pace and in the style that I'm living right now? Because I need to be like, I don't have time to stop. And I think that's when you were back then with your unhealthy habits with work, like you just needed something to prop you up so that you could keep going.
Yeah. And I think that you kind of hit the nail on the head there, that we don't want to stop. And so, I mean, look at the common doctor's visits that we might have today. We go to the doctor for a sore throat.
Yeah, I want an antibiotic.
It's like, doctor, I've got this sore throat. Can you just give me something so I don't have to slow down?
Right. Even if it's not a bacterial infection, which antibiotic is supposed to treat.
Yeah.
There's a viral infection. The antibiotic doesn't even really help, right? And we create this this bacterial resistance.
Oh, yeah. Antibiotic resistance.
Yes. And then, but if you go to the doctor and he says, well, you really just need to go home and rest,
drink
and
some fluids,
drink some bone broth. And
it's like, who wants to do that?
Yeah, no, doctor, the reason I'm here is because I want the fix. So I think it's like the people, when we're talking about why have we shifted from alternative medicine to conventional medicine,
we're resistant to change.
Yeah, I think we don't want to slow down.
No,
we don't think necessarily long term for our health a lot of times. Resistant to change. We want to save energy. We want to keep going at the pace we're going.
We value our current lifestyle more than we value our health.
Oh my gosh. I think that's the nail on the head right there. Is so true. Valuing our current lifestyle, not wanting to sacrifice that. But I mean, is it a sacrifice? Like
in the long run, no.
Tell us about you, like your story with working all those hours, okay, so that your business didn't go under and so you could provide for your family and you had this newborn in this new house. How did you give that up and still survive? And then let me just say this, you're not just surviving, you're thriving.
Absolutely.
And from 8 years ago, you work half as many hours and make probably triple or quadruple the amount of money. Yeah, but I think it's all due to your increased spiritual awareness, your mental health, and your physical health. Like I could not say it's because of one or the other. Like it's all of them. You working on all of those has created this life that you're able to enjoy now.
Yeah. Just all, it depends on really what you want to put your value on. I when I first got started, I felt like I had to do everything.
Yeah.
And I realized, years into my career, I was like, wait a minute, I'm really kind of a less effective person at, for example, bookkeeping, but yet I'm spending hours and hours on bookkeeping.
Yeah.
And it's like, okay, so I'm not a good bookkeeper. That doesn't really benefit me on my hourly. And so why not outsource that?
Right.
And so I began outsourcing that, and in outsourcing that allowed me what, 6 extra hours in my week that I didn't have to do my bookkeeping.
Amazing. Yeah. Well, and
when I could go to work for one of those extra hours and be all the better for it.
Well, and just giving that up I mean, a lot of people think I need to do everything because they want either control over it, or they don't want to spend the money that it takes to pay somebody for something like that. But ultimately, you were able to make more money and be a better version of yourself because you were healthier, you were happier, you were more capable, you were less stressed, you had more energy.
I got rid of the things I didn't want to do.
Yeah.
I mean, even so much as mowing my lawn. I hate mowing the lawn. So let's get rid of that. Let's outsource that.
Yeah. Well, I love mowing the lawn.
Yeah. So
if you see me outside, like trimming my bushes and doing I enjoy those things. So but everyone, like you're saying, has their thing that they enjoy doing. I wouldn't survive a day in your dental practice because I can't see those things that you see. Like I can't unsee them and then try and go eat food or something
for sure.
that because it gets dirty in there.
It does.
In your practice, since you have this alternative medicine route that you've been taking, we've been discovering so many kind of treatments that have been around for generations and generations, not necessarily from America, but other countries. How do you bridge that gap between the knowledge that you have of how alternative medicine can help and heal and transform, like we're talking mentally and spiritually, and the gap between that and what you've learned? I mean, you still have to sedate people, right? You still give people pain medication. How do you bridge that gap right there?
That's a very difficult thing because I do live in a world where a pill is something that is expected. That's very hard for me. And so, one of the things on my off time that I do is try to research homeopathic remedies.
For dental care specifically?
Absolutely. Yeah. But, in the long run, what's really sad in my career is that, if I tell a patient, hey, you know what, we're going to do this surgery, we're not going to give you an antibiotic because that can be bad for you. Let's use this other herbal supplement. For example, oil of oregano. Oregano is an amazing antibiotic, and you can go in and see the research and shows that it stacks up against amoxicillin really, really well.
But does it create
it leaves you smelling like a pizza.
That sounds lovely to me. Just throw in some pepperonis with your olive.
But it doesn't create antibiotic resistance, and it's very safe to do. But now I'm in this situation that I'm doing this surgery on this patient, and if I don't give that antibiotic and they do on the off chance get an infection, now it's my fault.
Oh, so would you maybe give them the antibiotic but say this is an alternative for you and you can choose?
Absolutely. Yeah. Okay. So I have to do that. So medical legally, I do want to give you this antibiotic, and feel free to take that, although there are these other alternatives. Same thing with mouth rinses. I mean, it's commonplace in dentistry to prescribe a mouth rinse called chlorhexidine, which is a really powerful antiseptic. But
that sounds very artificial.
It's disgusting, and it stains your teeth, and it's just not.
But that's common dental practice.
Oh, very common practice. Very common practice. But in the last 8 years, we haven't been prescribing that.
Why?
Because the research, when you look at the research, it shows, okay, how does chlorhexidine stack up against salt water? And that's only moderately more effective. Now, salt's one of the oldest antiseptics we have.
Yeah.
That's how we used to cure meats. That's how we still cure meats.
Well, even with hydration, right? Like if you add a little salt to your water, you're more hydrated.
Absolutely. So there's many uses for salt, but in our case, in surgery, we use it as an antiseptic. And so I'll tell patients to go home and mix up a cup of water with a teaspoon of salt. Use that as their rinse. It's much less caustic to the soft tissues, and the patients heal better.
Wow. So, and I mean, a side note, you're saving them money, right?
Oh, a ton of money.
Do you think that's why society, like our society, American society, has leaned more into, is it one of the reasons at least they lean more into conventional medicine is because of the money? Like,
absolutely.
I always think if you're like, why are we doing this thing that we're doing in America?
Most of our treatments are being driven by pharma.
Right.
By the drug companies.
There's no money in saltwater rinses. That's going to make the drug companies go broke.
Yep. Absolutely. And that would be great.
Well, for some, like you said, there are some.
There are absolutely some life-saving medications that.
Yeah. What are some medications like you would absolutely prescribe to somebody, or is there any?
Insulin to diabetics.
Okay.
I mean, we can talk about that. When we have certain heart issues, well, certain heart medications can help that.
Yeah. But there's like few, right? Yeah. So I've noticed with your practice that, sometimes patients will call you on day 3 after a big surgery. That's always like the day where they get the biggest flare-ups.
Yeah, day 7 actually.
Oh, really?
Yeah.
Okay, I'm sorry. I always thought it was day like 3 or 4.
Yeah.
But they call you and you're like, hey, do you have a tea? Like, can you bite on a tea bag to get the bleeding to stop? Do you have, are you doing your saltwater rinse? Are you resting? Mm-hmm. Did you put on ice? Like all of these things are free or basically free.
Yep.
And those are the best solutions that you can give them.
And many patients don't want to put their faith in those. They would rather put their faith in that pain pill that I prescribed them as a just in case. And then they run out of that and it's like, now what? Well, you weren't doing all the good stuff that I told you to do.
That's got to be a little frustrating.
I've just learned to be gentle and understand where this patient is coming from, because I used to believe that. I was that guy.
Yeah. Well, and with you, it's like we talked about the pain medication that you were on. It was an opioid.
Oh, yeah. Yeah. Oxycodone. I took a lot of that every night.
Yeah. And I think talking about the side effects of that, it was like not being able to sleep. So you take an Ambien, not being able to.
Insomnia, constipation.
Right. Pill for that. Low testosterone.
Yeah. So and increased pain. We don't even talk about that. I mean, the moment you go on to an opiate medication, it lowers your pain threshold. So things that typically might not hurt all of a sudden become painful.
What?
Absolutely.
What do you mean? Like what? How did you experience that?
Well, name it. Even life, even like something that causes
like
psychological pain. Even that, yeah. As soon as you start taking opiates, you just feel more pain.
Wow.
Which means you need more pain meds because your body
can't handle it.
That's
brilliant for the drug companies.
Oh yeah, they
because
love
you
it.
need more of the thing that's causing you pain.
Yep.
Wow, what a trap.
Mm-hmm.
No wonder it's like so addictive and such a problem for our culture right now.
And it's only until I learned to understand my pain, have empathy for my body while it's feeling pain, that then things began to get better for me.
Yeah.
So.
Yeah, nice. Okay, so last question. Jon, like, how do you see the future of medicine? Do you feel like people are becoming more aware of the benefits of alternative medicine?
Absolutely.
Okay.
Absolutely. And I try to advocate that, myself in my office.
Yeah. Well, you're selling the CBD oil in your office and you have patients coming back to get more of that.
But it all starts with having an open mind.
Yeah.
I mean, I think that's crucial. Research reputable sources. Find a qualified practitioner. You got to remember that all alternative practices aren't equal. But yes, I do. I sell CBD in my office now because in the past years, I'm dealing with patients with so much stress that they come back to me with chronic ulcers, or they're having skin sloughing issues in their mouth, or.
And what I didn't realize until we did one of our podcasts is you said cavities can be caused by stress.
Absolutely. Yeah. Stress causes dry mouth, and dry mouth causes cavities.
Amazing.
So
the CBD oil that you are giving in the office, it has many uses.
I think
stress reduction.
I got it right there. We do this, we branded it Dr. Peterson CBD oil.
So proud of you. But it's like people that have canker sores, they put it on that and see healing benefits.
Absolutely.
Stress, not being able to sleep, and all of these things, like you're saying, affects the body. So while they might think, oh, we're always told like a cavity is just caused by sugar or something like that. It's like, no, what else is going on in your life?
And many of these I can't speak to because I'm not an orthopedist. I'm not a chiropractor. I work in the mouth. And so, for me, I have to say, listen, we're going to do this for the mouth. Here's what to expect. Yes, it will lower your cortisol and stress levels. Yes, you will have less mouth ulcers, but pay attention to what else it's doing. And many patients actually come back to me saying, oh man, my arthritis, it's gone.
Right. And you're not treating them for the arthritis.
No.
It's just like a good benefit of taking the
Absolutely.
CBD oil.
And while we're working on these other things, I mean, I have this one patient, a wonderful, wonderful individual. She's now off of 2 of her medications that she was taking for rheumatoid arthritis. Now treating those with plant medicine.
Wow. Just the CBD and wow.
Yeah, she's off 2 of her medications for rheumatoid arthritis and feeling wonderful. And her goal is I don't want to be like my mom. Her mom is already, the RA has taken over and has just crippled her. And she's like, I don't want to be that person.
Yeah, I think that's the thing I've noticed with some medical treatments that we have is like, they can only take you so far, but a lot of them don't actually heal the body.
No, these are not medications I don't believe are meant to be used long-term. I think that, we, for lack of a better word, we do our body an injustice for not slowing down or changing our lifestyle, for the sake of improving our bodies. We just don't want to do that. But what are we doing with a medication? We're propping ourselves up so we can just continue to live the same lifestyle. And I don't think that's what God wanted us to do.
Yeah. What do you think God wants us to do?
Well, he wants us to be healthy. He wants us to be happy. He wants us to experience a 50-50 of joy and pain, because through the pain, that's how we grow.
Yeah.
But we're given this temple to take care of for our souls. And our job here, in my opinion, on earth is to just give our souls the ride of its life. And how can we do that without looking after our health?
Well, I think with the opioids that you were on before, that wasn't even possible. Like you couldn't even access your soul and what your soul needed. And like your mind was, elsewhere so many times as well.
Anything that we use to numb ourselves out will cause that. It will prevent us from accessing soul.
Taking opioids out of the equation, I think even overworking like you were was causing that detachment.
Well, that was filling a void for me. It was filling my own void of not feeling good enough. And so through working hard, my hopes is that I would feel better about myself.
Yeah. You know what? I feel that too. I was just talking to a friend today at the gym talking about my depression, which I want to specifically talk about in a future episode. But I said, there were some days where I would go to the gym and just, go to the parking lot and then go home, because I couldn't, I could make that action happen. And that was a big deal, but I couldn't actually go into the gym yet, but I was working up to it. And he said, that's so wild to me, because you always seem like you're just go, go, go all the time. Like the Energizer Bunny, you just never stop. And I said, I think that has a lot to do with being afraid of stopping. Like when I'm going and going and going, I can repress all those feelings and I don't have to deal with what's going on in my mind or my soul or anything like that. And I can just keep the status quo, high functioning. But if I stop, then I'm in that place where I start feeling. And like you said, very painful.
Many people use work as a crutch that way. You're not alone.
Work.
Or serve.
So whatever form of staying busy and not spending that time to connect with your mind and soul. So I am super passionate about that. I want to talk about that in an upcoming episode specifically, because we've had some great journeys with that topic as well. But Jon, what is our why? Why did we create this episode today about bridging the gap between alternative and conventional medicine? What do you think?
Man, well, I would say probably the vision would be in healthcare is for conventional medicine or modern medicine to live harmoniously with alternative or ancient medicine.
Yeah, I think my why is to shed some light on the options that are out there. There's so many options. I mean, I have clients that are like, oh yeah, I've tried everything, but they've really only tried a few things from pharmaceuticals.
Yes. Yes. Yeah.
And
That's
it's
it.
like there's
It's like, let's try column B.
There's a whole world of possibilities out there, and you've only tried like a few things, and it might feel like everything because that's the only thing that that doctor has told you is available to you. But I think my why is like to keep searching, to keep questioning, and to open your mind to possibility.
And I think that, you might have had an experience a couple of weeks ago
Yeah.
where your mind was opened.
Yes. Yeah. Going to talk about that in future episodes. We can't talk about everything in one day, Jon. Thank you so much for joining me today. It's been so good talking to you about this. I love having you on. You're great.
I love being here.
Ah, sweetie. All right. We'll see you next time. Bye-bye, everyone. I hope you found value in what you heard today. If so, please follow us and go give us that 5-star rating. It really helps us reach more people that need to hear this message. Also, if you're ready to make changes to your health and well-being, go check out our Fat to Fuel program. Our coaching program empowers you to make healthy changes to your life one step at a time. Go to fattofuel.com or click the link in the show notes. We hope to see you there.